Hi, everyone. Welcome to today's virtual discussion. We see that people are starting to enter the room, so welcome. We're just going to give it about a half minute or so, and then we'll get started. Hello, welcome, everyone. Feel free to use your chat box to say hello. Let us know where you're calling from today, and we'll get started in just a few seconds. Right, welcome, everyone. I see some more people are coming in. I see Melissa Fry from the Pennsylvania BEOC. Hey, Melissa. We have Juan from Tallahassee. Bill from San Diego, love San Diego. And we see others coming in today, and all right, I have 431, so let's go ahead and get started. Feel free to continue to chat your hellos to us as you're joining us today. I'd like to welcome you to the All Hazard Consortium Business Resiliency Virtual Discussion Series. We've done now about 20 of these, and today we're going to focus specifically on state BEOC, which is the Business Emergency Operations Center program, and how the relationships have changed since the pandemic. So I'd like to start by introducing myself. I'm Laura Johnson. I'm the Director of Conferences and Events for All Hazards Consortium. Just have a few administrative remarks today before we get started. First, you've all been muted upon entry, but feel free to use chat or the Q&A box to send us comments or questions. We will have time at the end of the discussion today to get to those questions. And if we have time at the very end, we'll even unmute everyone and give you a chance to say hello, introduce yourself, ask any questions that you want verbally. The other thing I wanted to let you know is that we are recording today's discussion. So we will share that link with you after the webinar concludes. You can share that with your peers and your colleagues, or listen to it again if you like. So we make that available to you. I'd like to introduce Tom Moran, who is the Executive Director of All Hazards Consortium. Tom?
Great, thank you, Laura. This is my all-time favorite topic, right? How industry and states work together. As I learned a long time ago, if you really want to fix something during a disaster, you better be connected to the states, because they control the roads, they control the resource. And you know what? It proved to be true. So I'm really happy all of you have joined us here. This is a long discussion. Yesterday, just the warm-up call I thought was eye-opening, to say the least. So I don't know if we'll get to it all today, but I'm really, really happy that all of you can be part of this. You may hear us reference the SICE, the SISE. What is that? That is a framework for information sharing built by the private sector in 2015 that provides the legal process, technology, and data information sharing network, if you will, for operational information sharing. You can subscribe to that at no cost at siceusa.org. It's where we house the data and information that we are using right now during this response to Hurricane Paula, which looks like it's going to be a bad one. So that's where we share operational information and webinar and all that kind of stuff. So we invite you to join us, and really, really glad our speakers are with us. And of course, you all that have been on us for, I can't believe we've done 20, Laura, unbelievable.
I
know. So the fun part of that is I get to work with Laura and all of you guys over again, which is great. So I'll hush, and I can't wait to get into our discussion.
By the way, I'm not sure what hurricane name you said, Tom, but it's Hurricane Laura.
I did hear. Did I say Laura?
I think you said Paula, but okay.
I wrote an email, and it's a reference Hurricane Paula, so I'm sorry. It is Laura. It is
well,
Laura.
My husband says I am a force to be reckoned with, so.
Yes.
All right. Thanks, Tom. I'd like to introduce today's panelists. From Maryland Emergency Management Agency, we have Allegra Tartaglia. Allegra has participated in our sessions before, so welcome back, Allegra. We have Mindy Lehman, who is with the Maryland Bankers Association and is therefore a partner of Allegra's. We also have Molly Doherty from the Pennsylvania Emergency Management Agency. And today Molly has brought with her Carmela Hinderaker, who is with the CNS Wholesale Grocers, and Bob Crow from AmerisourceBergen. You also may have met Bob before when we did our healthcare supply chain discussion. So welcome to all of our panelists. For those of you who have attended our discussions in the past, you know that we ask a series of questions. We have 5 questions today. I think that we'll actually get through them all in the next 60 to 90 minutes, and that includes time for Q&A. So again, as we go through these questions, feel free to type in your questions and we will get to them towards the end of the discussion. So the first question today deals with the operational impacts. How did the pandemic change the way that you integrated with your partner? It doesn't necessarily have to be the partner that you brought today for the discussion, but we'd like to hear more about the challenges it created. So Allegra, I want to start with you, and before you answer the question, if you could just tell us a little bit about yourself and your role with MEMA, and then you could proceed with the question. Allegra?
Thank you, Laura. Hi, everyone. My name is Allegra Tarsali. I'm the private sector liaison for the Maryland Emergency Management Agency. I head the private sector integration program, which is a blue sky. So what that is when we're not activated in the State Emergency Operations Center program that enables private-public partnership fostering and creation of new partnerships within the state of Maryland and the private sector in order to ensure operability and safety of the private sector employees and private sector businesses fostering. And furthermore, we also have an operational component of the private sector integration program, which is the Business Emergency Operations Center. And I have been leading the Business Emergency Operations Center as the manager for COVID-19 activation with a wonderful team of 10 between MEMA staff and Department of Commerce. And a little bit about myself, I am Italian American and I come from a line of service. So this is in my blood and in my nature to be working for the Maryland Emergency Management Agency. So I'll go ahead and answer the question if that's okay. How did COVID-19 change the way you integrated with your partners, and what challenges did it create? So first of all, I want to focus on integrated, and I have 4 words. I have mutual trust, service, partnership development, and problem solving. The reason why I bring up these 4 is because without mutual trust, you can't acquire any partnerships and you can't acquire more. Service is basically the service that the public sector does for the private sector and vice versa. Partnership development is through obviously trial and error and fostering the trusted relationship, you develop more partnerships. And problem solving, because of certain issues and needs that need to be met, problem solving is a whole community approach. So the integration between the private and the public sector and nonprofit communities and volunteer organizations are needed. So how did COVID change the way you integrated with partners? Well, we had agency partners, so the state coordinating functions serve better the PSEP members. This is because of the partnership that we developed with the public sector to educate them of the private sector integration program and of the Business Emergency Operations Center role. We also needed a way to have cross-sector coordination and communication for information sharing because of the impacts that COVID-19 had on the economy and on supply chain. And this knowledge of the impacts of economic and supply chain were acquired by the by the information given to us by the private sector because of the mutual trust we had acquired. And something that we did not usually do was to solicit vendors. And that is not something that we promote with the Business Emergency Operations Center. While we welcome to push out any information that might be useful for any business to stay operational, even vendors themselves, we don't really go out and solicit vendors. But because of the shortage and the complications of acquiring personal protective equipment, we did a reverse, and we actually blasted out and went to solicit any type of vendors or manufacturer that, but because of the shortage of acquiring personal protective equipment, we did a reverse, and we actually, and through that, we were able to continue to support additional businesses for their operability, because even though they weren't partners of the PSIP program, or the private sector integration program, because of the positive feedback our partners were giving to their industry sectors, and thus we were able to amplify our partnership. And at the beginning of COVID, we had approximately 600 members, and after COVID, we have 900 plus. And lastly, something that we hadn't really thought of that we would be involved in was the support of large donations, and that also was enabled us to integrate and to acquire more partnerships. Some of the challenges that we faced came from the primary word called bureaucracy. And bureaucracy, I like to divide it into two components. Bureaucracy stalls time, which is crucial in emergency management and for the private sector. And bureaucracy encourages politics, which stalls time and basically is a never-ending sequence of unfortunate events. So in order to break through the bureaucracy, which, like I said, stalled the response to needs from the private sector, or for example, another challenge was we were receiving needs that we were not trained in, because one of the difficulties that we have in Maryland is that we don't get activated often. And COVID, we had a few events prior in the year that activated the Business Emergency Operations Center, mostly weather events, but we hadn't put into practice our plans and procedures. But there were also items that were not integrated or accounted for in our plans and procedures because of this unprecedented event. So that made it challenging. Also, understanding the roles of the various public sector departments as events were unfolding so fast, because we as a state are very innovative, and because of that, we have so much fast-paced growth within our agencies. But that did hinder the knowledge of who was capable of doing what. And so the way we mitigated that, however, was open and transparent communication and the strong relationships we had built with our state partners that broke through that bureaucracy, and together we identified the loopholes to speed up the response process and to address the private sector needs. But it was a mutual effort. Not only were we doing that on the public sector side, but the private sector was doing it for their industry, but contributing important feedback to us to take into consideration when managing these challenges and hardships.
Hey, Allegra, thank you so much. If we could just take a step back for a second and talk a little bit about what is a BEOC. I don't want to make assumptions that the callers on the line know per se, or they might work with states or be in a state that doesn't have one. So can you just take a little time to explain about the benefits of your BEOC and a little background?
Sure thing. So the Business Emergency Operations Center, which back in 2012, people were calling it in the emergency management industry Business Operations Center, was a concept that was promoted by FEMA after Hurricane Katrina and other natural hazards that had occurred. And as we saw in these events, the private sector had stepped up to the plate to help public sector response and recovery, because public sector was pulled so thin. And we all saw that, especially with what happened in Puerto Rico and Texas at the same time, and in the Northeast. Nowadays, we are facing challenges in the world with multiple hazards happening and occurring at the same time, which stretches the public sector so thin, but could be helped and leveraged by the resources and the strong problem-solving efforts and the speed of the private sector. But the only way to do that is to have, again, mutual trust and for everyone to come to the table. And so, as I was mentioning, back in 2012, there was a fund that was distributed across the nation by FEMA, the Federal Emergency Management Agency, in which it encouraged state emergency management agencies to start their own private-public partnership program. And in our agency, that did start around 2012, and we did have a plan for Business Operations Center. But we, as the objectives of that Operations Center, were to provide communication, foster partnerships, push out information during activations. We realized that all of that can't just occur during an activation, but has to occur prior. And another problem that we identified was that in an emergency, the private sector, but even a normal citizen, would like to have immediate communication and contact with someone on the other line. And identifying a private sector liaison, which is Molly, myself, and others, if you guys have been on most of these conversations for the past 20 episodes that you've had, my counterparts in Florida, Beverly Bears, Persia Payne Hurley, North Carolina, and many more in California, etc. We are basically the conduit of the private sector into the public sector, but also we promote ourselves as the public sector conduit into the private sector. So we provide that information sharing, we set expectations, we inform and educate both the public sector and the private sector of our capabilities and our potential needs. And this year, I've coined myself the matchmaker. I feel like Fiddler on the Roof, because it is true, the fact that we are constantly engaging both on the private sector side and understanding our partners' needs and are listening to their training and exercise and how they're partnering either with industry or their local community, emergency managers or county officials. That is information that could be helpful when someone in the public sector side, either at MEMA or in our state coordinating functions, are developing plans. And they might not necessarily have the connection or the contact or the time to make that relationship or to understand that there are other conversations happening on the side. And so I like to be the matchmaker to put the two constituents together to ensure that we are not making assumptions of what the private sector industry is doing in a state of emergency, or to take retro action during and prevention prior to an emergency. But we're really understanding really the lay of the land. And so now we have, when I say we, my private sector liaisons and I have transitioned into identifying not only a business operations center in our SCOC, but transforming it into its operability component, which is during an emergency. So now that's why we are coined the Business Emergency Operations Centers. And we communicate during an activation directly with our FEMA liaisons, private sector liaisons, at the regional level. I believe we have 8 regions, but I could be wrong. The United States is broken up into regions that are smaller subsets of the national headquarters of the Federal Emergency Management Agency that communicate specifically with a certain number of states in that region. And that private sector liaison, which is Melissa Weisenstroden in FEMA Region 3, communicates directly with FEMA headquarters. And the communication is not only top down, bottom up, but it also is horizontal. I hope I was able to give a good layout.
Great. Thank you so much, Allegra. Allegra brought with her today two of her partners, one of which is Mindy Lehman with the Maryland Bankers Association. Hi, Mindy, if you could tell us a little bit about yourself and how the pandemic changed the way you worked with MEMA or any of your other partners.
Sure. Thanks, Laura. And it's great to be here. I appreciate the opportunity. And it's just been wonderful working with Allegra during all this. It's just been a pleasure to get to know her better and to work with her outstanding team. So to give you a little bit of background on who I am, I work for the Maryland Bankers Association. So we're a 6-person office trade association that represents FDIC-insured banks across Maryland. So there are 87 of them, and they range from the very large, your Wells Fargos and Bank of Americas, to your regionals, which would be M&T, for example, to your smaller Maryland community banks. So the Maryland banking industry employs close to 27,000 people. We have 1,600 bank branches across the state, and we have 4 million employees. So that gives you a scope of the banking industry. And the financial service sector has been identified by Homeland Security as part of the critical infrastructure for the country. So that gives perhaps a little more perspective on how we are connected with MEMA and the other organizations. So taking a look at how do we change the way that we integrate with our partners? So the partners that we deal with on a regular basis include our federal and state regulators, our member banks, of course, our national and state trade associations. So we have national bankers associations, and then we also belong to a number of our statewide trade associations, like the Maryland Chamber of Commerce, for example, as well as other business organizations across the state. So we have excellent relationships with all of these groups, but I tell you, COVID-19 just accelerated everything. Suddenly we're getting massive amounts of information, changes going on at the federal level, be it related to the federal CARES package, the stimulus package, to changes happening at the state level involving the governor's executive orders and related closures, and then down to more the micro level at the county level, as we started to see the facial coverings become more and more localized and specific things. And what we found was that all of these relationships that we had previously established, we just needed to put them on steroids, and we utilized them, we leaned on them so heavily, and it was this continual process of what needs to be prioritized, where's the best point of access for that information, and how do we push that out to our members as quickly as we can. And it was fascinating, the level of interconnectivity that evolved over time, and we really needed all of those touch points to be able to respond as quickly and effectively as possible.
Great, thank you so much. I really appreciate that. One of the other trusted partners that Allegra brought with her today is Carmela Hinderaker. Carmela is with CNS. Carmela, how would you answer? Oh, first, if you could tell us a little bit about yourself, and then let us know how you would answer this question.
Yeah, no problem. Hi, Carmela Hinderaker. I'm the Senior Director of Business Continuity and Customer Support. CNS Wholesale Grocers is the largest wholesale grocer in the country. We deliver groceries to grocery stores. And pretty much I'm along the East Coast and then around the Southeast all the way to Texas. And then I've got buildings in California, building one in the state of Washington, and also in Hawaii. So for this particular question, I have many partners. I have many government partners given the scope that the company touches. So it doesn't just have to be where my buildings are based, it's also where my customers are based. Besides government, I also have food associations, similar to how Mindy had bank associations. And given that we are a national company, I'm going at a federal, a state, and a local level to try and establish relationships and get the information and share policies in this sense. So given COVID, my integration with my partners also went on hypersteroids. And there were also other people who were coming to find us once they kind of realized that food is super essential, and people were wondering why shelves were empty and where is Clorox wipes, which wait until 2021 for that. So one, there were definitely some relationships that I had established, and so it was helpful to just pick up from that and kind of say, this is what I need. Two, again, we made new relationships, and given the different jurisdictions and how fast the spread of the virus or how quickly a jurisdiction had to make a decision, made this super challenging as well as hard to keep up. Meaning, like, trying to understand the difference between a mandate, a proclamation, a declaration, a should, recommended, no, it is required, and then separately, is it enforced? Are you going to get arrested? Are you going to get fined? I mean, that's just what masks, you know. So it was really difficult, and I even think with our partners, it was kind of difficult for them to understand what is the true recommendation in that sense. And given that type of vacuum, faster decisions were made. The other thing was kind of some of the challenges that we've run into is when we first started meeting with some partners, they didn't really understand the scope of the food supply chain. And admittedly, I mean, I was learning some new stuff too through this whole pandemic. So for example, you know, when you were starting to see headlines about why are we killing a bunch of pigs that are in Washington when there's no pork around, it's just the food supply chain is super just in time. So the price that you pay for a gallon of milk, which is less than $2, it was a humongous disruption within the supply chain. And the fact that our normal contingency is to go to another region, to go to another building, to try and get the backup to backfill your inventory, or you're going through your stockpile. Given that everybody in the country was going through this, there was no backup. So you eat up your stockpile, and that's kind of where we are today. The lead time to make something didn't decrease. It still has a certain capacity that manufacturers and or truck drivers can drive given hours of service. So that is also where we had to kind of inform our partners, like how the food supply chain worked. I remember I got on a meeting with a particular jurisdiction who said, can you just bring in more eggs? And I said, well, you know, we kind of grow, I can't force the chickens to push more eggs out. You know, the chickens are grown in a particular way by farmers that they're already forecasting 10 to 11 months out as to how much eggs need to be available. The other thing is you're moving, because we closed restaurants and a lot of places where people got food, so schools also closing is where children also got a ton of food. You're moving that whole sector somewhere else where the other somewhere else was not ready to absorb. A lot of it has to do with packaging. So, you know, a restaurant might have a ginormous bag of frozen chicken breasts where I can't just throw that in a grocery store and expect a consumer to purchase. And so that was some of the challenges that we had, and we had to kind of inform our partners in the beginning. And so we lost a little bit of time to try and understand, well, what are you trying to work towards? Where, you know, eventually the government kind of got into some of that CARES funding went into how do they give funding for distributors that are normally distributing to restaurants, but now we can move the food so it goes to food banks where the need is much higher there.
Thanks, Carmela. That's so interesting how everything works together. So I appreciate you explaining that. I'd like to introduce Molly Doherty with Pennsylvania. Molly, if you could take a minute to introduce yourself and tell us about how COVID changed the way you integrate with your partners.
My name is Molly Doherty, and I'm Director for External Affairs here at Pennsylvania Emergency Management, as well as the Private Sector Liaison.
Laura, can you hear?
Can you hear me?
Yeah, a little low, Molly.
Okay, how about now?
That's good. Thank you.
All right, I'm using
that
a rather
expensive headset you got.
I was just going to say I'm using a rather inexpensive headset, and I think I'm going to change how I do that in the future. But so as I was saying, I'm the Director for External Affairs here at PEMA, and I also run the Private Sector Integration Program. And my background is actually in marketing and communications, and then also business continuity. So one of the reasons why when I was...
I can't hear her, Laura.
How about now?
Better.
All right.
I think Molly's just soft-spoken.
At times.
No, you have to hold it up. Yeah. Can't hear you
Hold on.
when you're down here, Molly.
All right. Now.
Keep going. I can't tell.
My background is in marketing and communications, and also business continuity. So one of the reasons why when I was brought to PEMA and joined the PEMA team is because I speak multiple languages. So I'm able to work in the communications and public information realm, but also I can speak governmentese. And there's also another language in emergency management, commonly known as emergency managementese. So trying to bridge that gap among multiple partners is really also being able to be multilingual. Whereas Allegra can add Italian with that. I can't add Italian, I can only cover emergency management and government and then continuity. But really with the way COVID-19 affected how we integrated with our partners is similar to kind of the tones of what you've heard from our partners with Allegra, Mindy, and Carmela, which is the sheer size of this disaster is it's global. And we've often said if there was an exercise where we brought in different agencies and perhaps different countries and governments and had an exercise that looked like COVID-19, we would have laughed everyone out of the room and said this is insurmountable and not worth our time, only to find that, well, when posed with the challenge, yeah, we can do it. And so because of that size, the first thing it affected was really who we define our partners to be. So our partners certainly are with the private sector, but that expanded to be both profit and nonprofit. So we have a number of volunteer organizations that, frankly, our communities would be in a heap of trouble if we didn't have that involvement. And then also our private sector partners. But it also expanded both the state agencies that we work with, Allegra commenting on having their Department of Commerce. We also have included our Department of Community and Economic Development. That's because they have an entirely different set of relationships and interests with businesses here in Pennsylvania. And so it really totally changed and it really expanded our network. And our partners, we can also include other governments, which we hadn't really expected to do. And coordinating with partners in Taiwan, Korea, and a number of other countries that had PPE that were able to share those with Pennsylvania. And then certainly my colleague, Mr. Crow, can talk about the air bridge, where that was partners with federal government as well as other countries to bring in PPE, and then working with our private sector partners on once it gets here, how do we get it to where it needs to go? So just the sheer question of who our partners are was completely altered. And really the challenges with the size of this issue, it came down to two things. Well, a number of challenges, but to be succinct about it, I would say the two main challenges were both how we work through the issues that came up in terms of there are, because of the size and because this wasn't an isolated state event, it was an event that involved
state governors, it involved the White House, it involved multiple national U.S. federal agencies, with the agencies that were the lead for this event being the health agencies, where typically it's the emergency management agency. And so when issues and challenges came up with our partners, there are issues that we can solve, and there's issues that we can't. And there's issues that the relationship that we developed are very suited for tackling specific operational issues. But because these relationships that we have with the private sector are decidedly non-political, and what that means is there are a number of businesses that have a regulatory relationship with state agencies. And the relationship that we develop with private sector and emergency management is a relationship by choice. But that also means that what we're able to do and problems and issues that we're able to take on to solve is limited within that realm. And so when states were dealing with what businesses need to close, what's considered an essential business, that poses a huge challenge both for the state's economy, the state's businesses, but then also businesses that are in multiple states, and trying to figure out, well, are we essential here? Are we not here? And like Carmela was saying, are we fined for operating or not? And so trying to work through with our partners, what are the issues that we can take on and solve, and what are the ones that we can recognize that it's there and try to work through how to solve pieces and parts to keep businesses operating. It's really how we had to approach that. The other issue or challenge is with sustainability of the program. And so we've shaped the program in Pennsylvania with the private sector integration. You know, if you have 50 states, you have 60 different ways to have a private sector integration program. And what we've tried to do is set up more of a structure and an institution for how those relationships are developed, so that it doesn't matter who is in that chair when we're activated in the BEOC. What we've done is the relationship is with that commitment and structure for how to get things done. So for us, one of the challenges is if you have a global pandemic, we're not activated for 3 days. We're probably, I think we're activated at this point for 179 days. And that is not an activation for one person or any number of people. What we really needed to do was work through, how do we have the roles defined within our agency for the private sector integration? And how do we set up the relationships that go outside of our agency into, you know, the Department of Aging and Department of Community and Economic Development, and all the other agencies that were working through the cascading problems, such as feeding and sheltering. And so the challenge we were faced with is, how do we create what we consider to be a program in the blue sky where we're engaging with partners to really a full-on long-term engagement for both resources, relationships, information, communications, PPE, and anything else that's going to be thrown our way for the next 6 months. So certainly my colleague, Melissa Fry, who's, I believe she's on the call, she's I call her my partner in crime. And then we have some external affairs folks that help with a lot of the communications. So I think those are really the two primary challenges, is the sustainability of the program, where it doesn't matter who's here, the program and the relationships continue. And then also really the being able to work through what are the issues that we can solve, and what are ones that we're just going to have to work through together.
Thanks, Molly. And who did you bring with you today, Molly?
Well, that's the interesting thing, and expanding our networks. Included in that is we've always had a very strong relationship with Maryland and Allegra and a number of states along the Eastern Seaboard. And the reason why there's such an importance for a regional approach as opposed to just a single state approach is that our partners don't stop at state lines either. So as Allegra had brought Ms. Lehman and Hinderaker, I'm also bringing Ms. Hinderaker and Mr. Crow. And that's because Carmela is a co-chair of our PA endeavor, which is the private side of the relationship. And so her work and the partnership exists in Pennsylvania as much as it does in Maryland, and I'm sure other states north and south of us. And then we also have Robert Crow, who is very involved with our program here and also in North Carolina, and I believe Maryland as well. So our relationships are what makes this program. And so I'm actually very excited about today because this always provides an opportunity for me to learn really from our partners what matters. So thanks.
Thanks, Molly. So we met Carmela, so let's now meet Robert Crow, your other partner. You may, again, have met Bob as he did one of our other virtual discussions, but Bob, why don't you take a minute to introduce yourself and address how the pandemic has changed the way you've integrated, not just with Molly, but your other partners.
Great, thanks, Laura. Good afternoon, everyone. Thanks for having me. My name is Bob Crow. I am Director of Emergency Response and Crisis Management here at AmerisourceBergen. For those of you who are not familiar with AmerisourceBergen, with most people are not, we are one of the world's largest pharmaceutical distribution and services companies. I oversee emergency response and crisis management for about 450 locations in 53 countries around the world. We are located headquartered here in Valley Forge, Pennsylvania. So we are a direct partner here with Pennsylvania. And COVID, how did it change the way we integrated with our partners? Well, it escalated the get to know you factor. Those of our partners that knew us knew a little bit about us, but they probably didn't know everything they needed to know about us. And all of a sudden, COVID put us in this position where they need to know not only what we do, but how we do it and who we do it for. And what that does or where that puts us in the whole grand scheme of things. Being a pharmaceutical distributor, we're distributing to local pharmacies, to long-term care facilities, and also to some of the largest hospital systems across the United States and other functions around the world as well. So getting to understand us, each member of the private sector, you know, they're going to interact, and especially with COVID, with hospitals and how care is provided. Well, let me let you know that if I'm having issues in my world, your hospitals are going to have issues in another 2 or 3 days. So understanding that I think is really important. Now, I can't tell you exactly how patients are being taken care of there, but I can tell you if our products are not getting through or not getting to those care providers for whatever reason, a larger issue is going to come on the horizon very quickly. So, and with that, it's not just about, well, keeping our trucks on the road, but what does that mean, keeping our trucks on the road? So let's look down at the next layer, getting our people from their homes into our facilities so they can pick, pack, and prepare that product to be shipped. So there are a lot of things that escalated that get to know you. I've been, interacting with Pennsylvania and with many other states as well, and with Endeavor for a while, but it hasn't been a very deep or wide understanding or knowledge base of what goes on here. So having that, and it's not just for me, it's with all the private sector partners. We do what we do, and in many ways we can make life easier for our state partners. But they also, we do depend on them for lots of things. For the longest time, I get emails from Molly or even from other states, hey, we're going to shut down the highways because of snow or something like that. And we'll get that advance notice, and that is great. We can get our people off the road. We know when to shut down our operations, so we can then begin to prepare to be the first ones back on the road after the issue is over. But it never really went to the depth of what COVID brought. Again, talking to Emergency Operations Center about roadways and about closures and things like that. Now all of a sudden we're finding we're talking with the rest of the state government, the Department of Health, especially with COVID. I mean, they really controlled everything, not just here in Pennsylvania, but all the states. And the challenges that it created, remember back when COVID started, COVID wasn't one big problem. It was actually 56 separate problems, being states, the District of Columbia, and the United States territories. And unfortunately, if it was just a single issue, and we only had to deal with FEMA or one single entity, that made life easy. But we had to deal with each state individually, and how things were changing on a rapid pace. There were times where it seemed like before we'd ask a question, and before the sentence was completed with the answer, it had changed already. So, with closures, with restrictions, with quarantines, and what was quarantine, what was not, who was critical, who was not, and making sure that that depth and breadth of communication and understanding was there, so we didn't get shut out. One of our largest distribution centers is in Bethlehem, Pennsylvania. But that distribution also services 5 other states in the District of Columbia. So anything that happens here in Pennsylvania could impact what happens in New York, New Jersey, Delaware, Maryland, or the District of Columbia, and vice versa. So having that, again, knowledge and understanding of who we are and how we do it is very, very important. And of course, it's just the strings that these private sector liaisons can pull. I mean, I know, forgive me for saying that. I know a guy. I got a guy. Let me call my guy. Everybody knows that joke. So we have several in this case, and not quite 56, but quite a lot. So I hope I answered your question.
You did, Bob. Thank you so much. And while I have you on mute, I'm going to move on with you with the second question. So what solutions did you implement in order to continue to meet your mission? What did you have to do based on how COVID affected your business? Bob, that's to you.
Oh, I'm sorry, Laura.
Okay.
Well, it really impacted the way we did, not necessarily the way we did business, but I'll go back to keeping our folks healthy and keeping them available. Again, going back to the very basics, if our people were not able to get to our locations to pick and pack and prepare for shipment, those products aren't getting out. They are the heartbeat of, they are the electric impulse that beats the heart of our company. Without them, we do nothing. We were dead in the water without our people. So, and what did that mean with COVID? Well, social distancing, yes, to the best we can do, but it's a warehouse, and people are going to interact with one another. We do have a high level of automation across our operation, but people were still necessary. So we had to implement changes for social distancing and for cleaning and making sure that we kept our places clean and understood that the folks that we are putting out on the road are able, again, to get from point A to point B, and how they're impacted. They're going into hospitals, which even in hospitals on the loading docks were high risk. And then at a certain point in time, many large hospitals actually would shut their loading docks down. Everything had to come through the front door, along with everybody else. So that raised as well. So that the cleanliness and coming across with understanding of what products were the best products that we should be using. Again, we're cleaning on products that people are going to be handling. People are going to be intaking orally or through some other fashion to make sure that we're doing the best to keep that ready. So that was probably our biggest problem, and then fighting for those resources. As you know, the Clorox wipes and all the other cleaning supplies that were necessary. That was probably our biggest challenge.
Yeah.
To stay mission ready.
All right, Bob, thanks so much. It does start with your workforce, so I appreciate that input. Mindy, let's move to you at Maryland Bankers Association. What solutions did you initiate to stay mission ready within the association, but also for your members?
Yeah, it's just such a great question, and I just love listening to Bob talk about what's going on in his universe. At the association level, well, I guess I'd start first by saying that banks are really the nation's first economic responders, and then that is our role in all of this. And from the association level, what we did was, as soon as this broke in March, we were very proactive with the media. For example, when they were beginning to cut those stimulus checks and mailing them to people, there were just overall systems were just overloaded in general. Like, things were happening, and this just isn't specific in the banking industry or government trying to push things out in very large volumes very quickly. So we were very focused on providing the most timely information to the public as we could for fraud prevention, to help people get their stimulus checks in as quickly as possible so they wouldn't be waiting to receive them in the mail, that you could actually go online and do that. And, I have to pause and think about how fortunate we are that this didn't happen 50 years ago. I mean, the mobile channels we have in the banking industry and with the government in terms of being able to exchange information and financial resources has just been a lifesaver on so many different levels. So we were very focused with media outreach. We initiated a COVID-19 web page on our site. So we don't typically, in our website lots of times holds member-specific information and banking industry-specific information, and we really widened that. So we became a source of information for not just our business partners, but for the general public as well. So that was something that we worked on. We were participating in weekly calls with Allegra, with the private sector, private industry. We were participating in weekly calls with the Maryland Chamber of Commerce, which formed a COVID-19 working group. And then we did that ourselves at the MBA level for our members. And then we were also participating in sometimes even daily conference calls and Zoom calls with our national partners. So it was this continuous stream of information, which was absolutely critical in being mission ready throughout all of this. And then we also were in regular contact with our federal regulators and our congressional delegation as they had questions and were looking for feedback, as well as at the Maryland state level. So that's what we were doing at the association level, and then looking a little deeper into what the banking industry was doing. So the banking industry, they were employers just like every other business. So the health and well-being of their employees was paramount. So they wanted, they had to stay on top of I've got a mosquito buzzing around me. It wouldn't be Maryland if I didn't have a mosquito trying to dive bomb me. So if you see some strange, expressions, you know what's going on. Yes. So, it was just as you were talking about facial masks, did you have enough? Where can you get them? I mean, banks usually don't have masks being worn inside a branch. That's typically frowned upon. But this was an environment where that changed really quickly. And we got questions about that. How do we deal with this? We don't typically let customers come in with sunglasses and a hat, let alone a facial covering. So we had to adapt. Banks had to adapt very quickly. And then when Governor Hogan, and we are considered essential businesses as a part of the nation's critical infrastructure. So our banks employees could come and go, but they were very cautious about that, concerned about the spread of COVID-19. But then as businesses started to close down, they realized they really needed to systematically close bank branches. And that is done extraordinarily carefully because banks have to assure an uninterrupted access to people's finances. So you need access to your funds 24/7. And banks had to figure out, a way to make that happen. And in some instances, if you had a safety deposit box, customers had to physically access the bank branch to get into their safety deposit box, or there might have been some other reason where they just needed to come in. So banks had to adapt very quickly to communicating with their customers, to instruct them on how to continue to have that uninterrupted access. And there was a lot of communication that went out. And, you know, fortunately, as I mentioned earlier, you know, we're in this era of mobile banking. You know, it used to be that people went to the bank branch to do their banking, and then it changed to, well, you wanted to be able to do it from your laptop or your computer, and now it's from your back pocket. You could actually do it from your phone. And that has really helped a lot of people. One of our members reported, sorry, it's a mosquito again. One of our members reported, because it's not just, we also have the ATMs, the drive-up ATMs that customers could access, as well as call centers. And one of our community bank members reported doing 5 years worth of call volume in 3 months.
Oof.
So from a staffing perspective, it was remarkable. I mean, bankers were working literally around the clock.
Mindy, was that because of concerns of access to their funds, or what were the thoughts?
It's a number of things. It's really what was also going on. So you have the health pandemic, and then as a result of the health pandemic and all these different businesses having to close down, it brought the economy to a screeching halt in a lot of ways. So banks were working overtime, helping businesses figure out, you know, if they had a commercial loan, for example, did they need a loan deferral, which means that they would be able to pause payments for 1 month, 3 months, 6 months. Do they need a loan modification where you rework that loan for a different interest rate, or you let them, they don't make any payments on that loan and they tack 4 months of payments or 6 months of payments onto the end of the loan. So bankers were working around the clock on that component of it for their business and commercial clients. And then on the same token, banks make residential mortgage loans. So you have homeowners that perhaps one or both of them have been furloughed, or they're unemployed, or they might just be really worried about what's happening. So there was very proactive outreach from our members to their customers, staying close in contact, because part of the challenge is your bank is going to know if you miss a payment, but they don't necessarily know that you've been laid off your job or that you're struggling. So they spent a lot of time reaching out to their customers, to their business clients, to help them assess where they were, and then did they need to do something with their financing? Do they need to look at getting perhaps an additional line of credit? So things that our members stepped up, you know, right away and did were waiving fees, offering these loan pauses or loan deferments, loan restructuring. We worked with the governor's office on an announcement that he made in a broad way, because they also, as a result of the CARES package and executive orders at the state level, they halted evictions, they halted foreclosures, and they halted automobile repossessions, for example. And all of that was really to safeguard, you know, this is not an environment where we want people being evicted. You know, this is not an environment where we want people going through foreclosure. But the banking industry, they were already working with all their customers on this, but those were all things that we needed to do and adapt. And, you know, it's interesting because the banking industry, like the medical profession, is one of the most heavily regulated. And I don't necessarily know that people always think about that, but banks are required by their regulators to have contingency plans. So they actually have plans in place for natural disasters. For example, if you have a regular flu come sweeping through your branch and everyone gets sick, well, what do you do? And there's a plan for that. So, but I have to admit, when I talk to our member bankers, I don't think any of them thought they'd be dusting off those plans in quite this way. But the good news was they all had a plan. And so, I mean, none of this was expected. I don't think any of us could anticipate this, but it was really remarkable how they really just put the pedal to the metal and focused on helping their customers first. And yes, and this, it was also very, because federal banking regulators are very methodical they're all about risk management and safety and soundness. And I really give them a lot of credit. They worked very proactively because banks are responsible for their depositors' funds, and they need to make sure that they're operating in a safe and sound way. So what that means is you can't make a loan that is really risky, it's definitely going to go bad. And that can create some challenges when you're working with a customer who's experiencing financial difficulties. And the federal regulators all work together to provide banks with the flexibility that they needed to be fast and proactive and provide additional flexibilities for their customers. So it really, it's so interesting how everything is interconnected and nothing happens in a vacuum, but it took all of that working together to respond as effectively as we were able to. And it's ongoing.
Mindy, I'm also really glad you brought up about the media as an important trusted partner. Look at Carmela and what her comment, I think it was about the cows or the chickens. Why, you need to tell the public, why are we killing these chickens and how does that work? And with Bob, if you're delayed in receiving your pharmaceuticals, why, what is behind that, and get that word out. So thank you for bringing that up. We're going to move next to Carmela for the same question. Carmela?
Hi, yeah. So the food industry is like an old dinosaur. We don't really move fast. This definitely made us move fast. So from a food supply perspective with new solutions, one of the things that we did was obviously everybody has to kind of ramp up. In general, food supply companies ramp up 120 to 130%. That's the capacity you can only push out given safety concerns. And knowing that this was long-term, CNS made a decision that we weren't going to work our employees past a certain shift. So we did shift maximum with hours. We also, of course, brought in third-party vendors into our network. One of the new partners would be, so when the restaurants closed and the restaurant distributors saw their business drop significantly, we actually had their selectors come into our warehouses to help us, as well as some of the trucks that were connected with them to come connect with us as well. A lot of the solutions we put into place, we plan to have kind of going forward as a backup option again, or even for wave 2, we're still kind of linked with our food distributors, just to make sure that if we need to share again, we would do that. There were a couple IT solutions that CNS put into place where our IT department had to really lift mountains. I mean, if I had asked them this prior to the pandemic, it would have taken 6 months, and they gave it to me in 2 weeks. So it only takes a pandemic to get the IT people to really push things out. But some of it is just invoicing solutions, which are just going quicker to our customers. There was some solutions that we put into place to help manage the volume into our warehouses. From a just overall supply chain, some of the solutions which the individual customer saw in the end was limits. So a customer can only buy so much when they're at the grocery store, again, so that everyone can get something. So those limits really start from the manufacturer, and then they come to us, and then we're limiting, and then the stores themselves are limiting to just, again, make sure that there's enough product on the shelf. Related to, back to IT solutions, so right before this happened, our IT actually moved us to a new platform similar to Zoom, but they call it Ring Central, that was taken over for our conferences and meetings. And so that actually allowed everyone to work remote, real quick. So we obviously still have warehouses running, but employees that are kind of more office-based now really work remotely. And then our customer call centers are similar in that sense too. I mean, it went all the way down to hourly employees, where there's always this discussion of how do you know someone's working? Well, the business is still running, so we're good. So I think, after COVID, I think it's an open discussion across the US about working remote in general, how that's going to look. And again, the pandemic really disrupted our business model. The whole distribution network had to change. We were considering going direct to customers out of a different partner, which is not something we normally do, or shipping them certain items that we know we can give them. We have fancy names for them. And so it also disrupted our cost model too. So we had to look at our budget. We also had to see what could be passed to customers, given that we were throwing a lot in. And obviously not have like price gouging be an issue at the same time. So a really fine balance in trying to assess, you know, our budget again. I'm trying to think what else we did. So yeah, so again, I mean, some of the things before going into here, we were watching in January. We were already planning with some jurisdictions. We heard about it happening in China. We had a pandemic plan. It was an influenza pandemic plan. You know, we kind of dusted that off, started bringing some stakeholders together, quickly realized the triggers on there were not lining up to what we were thinking about. I think the big discrepancy was we had a trigger around community transmission, but the call from the World Health Organization actually came before, which that did not happen in this situation. The pandemic calling from the WHO came way later, and so which was a really big difference on some of the triggers that we ended up pulling in the end. So yeah, I think that's really most of our solutions.
I appreciate that. Thank you. Let's move to our states. Allegra, what solutions did you initiate to stay mission ready?
Well, first I want to say I'm enjoying this conversation so much because in the immediacy of the emergency, we really didn't have time to go in the nitty-gritty. So while we got snippets of the nitty-gritty here and there, it's nice to now finally see the picture come full circle. But so the solutions we initiated at the Maryland Business Emergency Operations Center to stay mission ready came from the plans and procedures which were developed because we work on customer validation. So that means that our products are based on what our private sector members want and need. So we ensured that we had processes and procedures that responded to exactly how the private sector was ingesting information, what type of information they wanted, how they wanted it to be divulged, etc. And the first thing we did was exactly that, information sharing through our two platforms, our Virtual Business Emergency Operations Center, which is a HISNT board, which we then found out exactly from the private sector immediately that while it was a great repository as a basically digital library, it wasn't the most effective way to share the communication, and that they did prefer the emails and the phone calls that we had initiated. Another point was asking for additional staffing right away. We had already understood that there was going to be an influx of answering questions, education, but also, as I mentioned, dissemination of information, and keeping both the private and public sector accountable with either their requests or actions or needs. So we needed to have more staff for what Molly had described was one of the challenges. What is the sustainability of the Business Emergency Operations Center when there's usually only one private sector liaison that manages the private sector integration program, thus transitions into the Business Emergency Operations Center during activations. So because, as I mentioned before, Maryland doesn't necessarily get activated as often, we really ensured that our plans and procedures were as up to date with what the private sector needed for any type of event. And although they were general and not necessarily specific for a pandemic, they were general enough to be adaptable and malleable to the needs of this activation, which was helpful because, as Carmela pointed out, sometimes when we have a plan, we follow it too much to the T, and we don't know at what point, triggers can happen at different points in time, and so sometimes that can delay what action we will be implementing in that moment, rather than having more general plan didn't necessarily have us follow certain steps, and could be more adaptable for the evolving situation. And the solution also was that open and transparent communication right away. Because we are one person that manages these programs and one person that fosters the relationship both on the private and public sector side. We had immediate and open communication, not only with our private sector liaisons regionally, but also nationally, to feed off of the challenges and collaboration, problem solving. We were bouncing off ideas. As Molly was saying, not all one size fits all. So not all business emergency operations centers are structured similarly in each state. So as we saw California shut down, and then New York, and then Maryland, every state every private sector liaison was providing us information. We were all providing each other different information based on our governance structure and how operations were being conducted in our state. And because this was a public health emergency and Department of Health was lead, we weren't necessarily the agency that was calling the shots, but we were the agency that had to keep all the processes and the operational elements accountable and flowing and coordinated. And lastly, this was a new position that we never had integrated before, but to be mission ready was real-time knowledge and education for the BEOC members and the BEOC team and myself from the Joint Information Center. So the Joint Information Center had appointed a JIC liaison, that's short for Joint Information Center, which was an individual that ensured that the Business Emergency Operation Unit was not only receiving the necessary information from all parties in the state to educate what Carmelo is bringing up. What did a disaster declaration mean? What did an order mean versus a recommendation, etc. We were continuously learning as we were educating, and we needed a liaison to provide us that information because of the pace of how fast everything was evolving. And so that was definitely something taken into consideration right away to be mission ready and to have that sustainable continuity of operations. And that enabled us to support Department of Commerce, which was flooded with inquiries from the private sector, and provide answers or help. We couldn't interpret, because we're not lawyers, we couldn't interpret the orders for the private sector, but we could take the time to explain or relay where they could potentially get legal advice to interpret to best take decision in their industry.
Okay, Allegra, thank you so much. Last but not least, we'll move to PIMA. Molly, what solutions did you look at initiating? Molly, you there? Oh, you're on mute. Mm-hmm.
Can you hear me?
Yeah, you're good.
Okay. I was going to say our first solution will be to get a better headset microphone, but then also you would think by now I would know the unmute button on Zoom. But so yeah, the solutions that we implemented are really in kind of 4 areas. And the solutions are really defined by what the core challenge was, which is all disasters are local. That's how we run emergency management. The role of emergency management, especially on a state level, is a coordinating agency. And what that really means is we have information and we have resources. We don't go out and fight fires. We typically don't go out and directly save people, although some would argue we do have teams that do that. But we're not the responders, we're the coordinators. And because of that, typically in a natural disaster, we coordinate that by getting information from our local emergency managers and our local responders that comes up to the state. We use that information to develop what we call a common operating picture. And it's basically so that everybody's working from the same page and understands what the problems are. And then we figure out what resources are needed so that we can go find those resources. In this situation, when we say it's a Department of Health driven event, either on the state level or on the federal level.
Can you hear?
Can you hear
Yeah.
me?
Yeah, I can hear pretty well.
When we're talking about COVID-19 and we say this is a Department of Health driven event, whether it's HHS on the federal level or the Pennsylvania Department of Health, what that means is it completely changes how we get information, how we develop what that picture is, and then how do we know what the resources are. And that's because we can't get information about the impact in the situation from the local emergency manager on what does the COVID spread 19 look or COVID-19 spread look like? What are the resources that you need? And the reason for that is that was coming from the federal government down through the Department of Health. So we had to completely restructure how we exchange information. And so the solutions that we developed were in a couple of key areas. The first one is we have to make sure that the emergency stays outside of the operations center. And so the way we do that here is how we were communicating to our partners on how they need to do it. Wash your hands frequently, wear a mask. We had temperature checks at the door, and we still have them, and then we have little wristbands to show that we don't have a fever. And so we were living it as we were communicating it. And a lot of the challenges that we had with that were reflected in the questions we were getting. And so those first couple of weeks that we had our temperatures checked, I was 96 degrees, which is fine if I'm living in one of Carmela's cold storage areas, not if I'm a human being coming to work. So the communications and the tasks that we had for our employees are very much like what you would see implemented in any of um, the other private sector areas that we were communicating. And also the mental health support was huge. People were under an enormous amount of stress. And so we also brought in a crisis intervention team for people to be able to talk. Three other areas that we developed for to be able to be mission ready in terms of supporting our partners was, Mindy was talking about that information. It was like what would normally be a faucet of information was now a fire hose, and it was coming from everywhere. And it was really difficult to know what was a priority based on the sector and the issue. And so we set up, rather than just continuing to push information out, we set up a rotation of morning briefs and afternoon roll-ups. And it was a lot of information that we were getting from partners, that we were getting from other state agencies, federal agencies, and sending those out. And we're actually still in that rotation. of morning and afternoon. The, the third area was, um, and this was really interesting when we started to close businesses. CNS was actually the first partner to raise the flag and say, by the way, if you're looking at shutting down businesses, expect to find these shortages in your grocery. We're going to have trouble having people show up to work because there's no daycare solutions. What daycare solutions are you working on at the local level? And they were also identifying what are some of the supply chain and cascading effects that we can expect to see over the next 3 weeks. The information from an emergency management and coordination perspective was gold. Uh, Bob Crow did the same thing when we set up our sector meetings. This is what we're seeing with the distribution of remdesivir. This is what we're seeing that, like he said, if we're having problems, expect to see these problems in the hospitals in a few days. The information was gold. The challenge was, how do I take that fabulous information and get it to where it needs to be acted upon? So the third solution was we strengthened our connections with our situation awareness unit, which is the group that takes in all of this information and produces reports and pictures and all sorts of fancy things. But we established a more consistent connection so that when we do find those golden nuggets, we're able to share that. They understand in the situation unit how that information should be used. So if CNS or if Amerisource is sharing information, this is not information to be taken and run up to the governor's office and say, CNS says blah, blah, blah. It's much more nuanced, and it's used for planning in an operations center. So the third solution was really making far better connections with our situation and operations units so that they knew what to do with that information when we got it. And I'd say the fourth area that was the fourth solution was setting up our systems for accepting PPE donations from private sector, which was a mammoth undertaking. From a legal perspective, much less, you know, an IT systems perspective. And then also being able to set up exchanges for businesses to be able to go find PPE when they weren't able to source it and we weren't able to source it. Being able to develop those exchanges through our Department of Community and Economic Development. Those were really that was really those key solutions in being able to at least get PPE in the door and then back out the door.
Okay, thanks, Molly. Molly, you actually touched a little bit on our next question here, which is how did you change the way you communicated and prioritized? You talked about your AM briefings and your PM roll-ups. Is there anything else you'd like to add in regards to communication or prioritization? Or if you have any advice to any of our listeners on the phone on what would make it easier for others to work with you and vice versa?
Sure. So what is it? Using something is the best form of flattery, or I forget what that is. We actually, we stole Allegra's idea and implemented kind of cross-sector meetings that we held.
Clearly here.
How about now?
Yeah,
Great.
that's better. That's better. A little low. A little low. Okay.
Okay. What you missed, Tom, was me admitting that I stole Allegra's idea and had cross-sector meetings. It started out as kind of twice a week and then once a week, and now we're bi-weekly. And that was one of the reasons why we really were just so thrilled with how Allegra and Maryland had done that. Is that was a real exchange between private sector and public sector in a really an open, honest, trusted environment. Uh, and so I think one of the things that changed for us is during Blue Sky, we try to engage our partners with solution development, operational solutions, that is, in order to be able to maintain those relationships. So I would say something that would make it easier, I think, for us, that would also produce great returns for private sector, is that when you can have folks, trusted partners involved in discussions, and when they're asked for input, to engage and give that input and get involved. And certainly we respect that no one has time for another job. And certainly giving government lots of information may not be considered a real priority. But being able to engage through when somebody from a private sector program asks a question and asks for input, getting that input from your perspective in the private sector is absolute gold. I
Yeah.
can't stress how difficult it is for folks in state agencies to ask the public information.
Yeah.
And so using that private sector liaison to actually have those exchanges is so important. It's hard enough for the private sector liaison in a government structure to reach out and build that network. And so I would say something that would make it easier for us, but then would also, uh, private sector would see a great return, is when the private sector program asks a question, give your perspective, because it's valid, it's important, and tremendously valuable.
Sure is. All right, great, thank you. Bob, let's move to you on this question. How did COVID change the way you communicated or purchased within your organization? I realize I have a typo on the second question, which should say what would make it easier for other sectors to work with you and vice versa.
Within your organization, it just, it meant more communication. It really did bring out the best of the programs that we had set up. People playing the roles that they were trained for, and making sure that everyone understood what the process was for communication, who to go to for certain questions. Obviously, this was bigger than I think anybody had planned, obviously, in any of their plans, even their pandemic plans. This was bigger than anything that had been written down or had been created. So, and early on, we realized that, you know, we had a crisis management plan, but this was way bigger. And we had to quickly adapt to that. So, you know, we took a lot of the people that were involved in that plan and we either elevated them or not separated them out, but made them stand out and had those processes developed for the communication. If you're looking for this type of information, this is who you're going to. And if you're providing information, this is who you're providing to, so that the processes stayed. I was just scrolling through my COVID email file, and I have over 5,000 emails in my COVID email file since the beginning of that time. Unfortunately, I save all of those. And I was thinking someday when we're all back together somewhere at a conference and we're having happy hour, I'll tell you that story, why I save every email that I get. And it will make you laugh, but it was just too big. It was too big for even our wildest dream for our plans. So that's how it changed. It really streamlined it. For that communication. What would make it easier for others? Well, quickly before I jump to that, with our partners, with our state partners, I have to bring up the dashboards. The dashboards are so simple, but yet having that ability to go to that single place and find information, whether it's the Pennsylvania Business Emergency Operations Center dashboard, or whether it's any other state that has a dashboard, or even the FEMA dashboard. There's questions being asked by others that I would have never thought to ask. And it pops up right in front of me and I go, hey, I didn't think about that. and 30 seconds later, there's an answer from someone on how to handle that issue. Or I have a problem and okay, I could call and I could leave a message on someone's desk phone because most people aren't working in their offices anymore. And I can wait for them to retrieve that and get back to me. And it might be, maybe if I'm lucky, it's by the end of the day. More than likely it's tomorrow or maybe by the end of the week. Oh, wait a minute, there's a chat box on this dashboard. Let me just throw that up on the chat box. And the next thing you know, 30 seconds later, somebody, at least they're saying, hey, I see your question. I don't have your answer, but hang on, I'll get back to you on that. So I did want to bring that up as far as the communication process. Those things are great. We learned that we needed relationships with people that we never thought we needed relationships for. And if we can only figure out who those people are in advance next time, it would be great. I don't know that we will ever do that, but not to put the pressure on Molly or Allegra, but you guys have access to a lot of people. You do, and through the meetings coming through and the exercise meetings and things like that, we get to meet people and we get to exchange business cards. But lots of times, even if it's a multi-day event, those business cards never make it back to our office with us. So you know, they're a source, and I've leaned on my partners before in that area. So, hey, I need a connection here. Can you help me? And 99 times out of 100, they're able to come through. So understanding who those players are and having them as a go-between, or not a go-between, but a help, just pointing us in the right direction. Has
Resource. A resource. And speaking of a resource, thanks, Bob. Associations are huge. So Mindy, I'm going to move to you. If you can just quickly let us know how COVID changed the way you communicated with your members and how priorities changed too.
Yeah, absolutely. It definitely ramped up the frequency. It was, you know, we went from our normal level of communication to, just as Bob talked about, I mean, it was just hundreds of emails we were getting a day. And then, you know, it was an interesting combination of sort of, we're all in this Zoom universe now, but then a lot of what we did ended up being very low tech. And Allegra's conference calls and the Zoom meetings with the public sector, private industry were really valuable. I mean, that enabled us to speak to a broad audience about, you know, banking sector concerns and then hear theirs. And then it was interesting how we were able to interconnect on that. And then that also enabled us to fast track concerns regarding a lack of clarity, for example, around a facial, an executive order on masks or availability of PPE. That those connections enabled us to fast track that with the Maryland Department of Health and the governor's office in a whole new way. And that was very effective in elevating and resolving issues, not always resolving them, but it helped get clarity where we needed it. And that was tremendously valuable. You know, it was interesting. One of the things that the banking industry was very much involved with was the Paycheck Protection Program, which pushed out over $600 billion in a matter of months. And we worked very closely with Treasury and the Federal Small Business Administration. And the Small Business Administration puts out about $2 billion in loans a year. So the entire systems were continually crashing. And it was when I talk about low tech, it was really remarkable because I had bank presidents and CEOs with one or two other people, because only a couple of people could get access to this SBA portal to upload loan applications. They were there at 3 a.m. in their banks, keying in loan applications. And as the systems were just getting overloaded with questions, because they were building this program, you know, they were building the airplane as it was literally taking off the runway. So that type of environment inherently creates hiccups with the rollouts and communication bumps. And what we found was, you know, sometimes you just have to go low tech and you have to, you know, go to your most local point of contact, and then you have to elevate to your national trade association, and you just have to continue to bang away to get the answer to the question. And it really took a lot of partners in that process. And that's just one example, but our calls with Allegra and her group, it was one of the things that I was impressed with was you would have business owners coming in with questions about that PPP program. So I didn't think that was a forum where those questions came up, and it really provided for a valuable exchange of information on that particular issue as well as many others.
Okay, Mindy, thank you. Carmela?
Yeah, same thing with Bob and Mindy. So we obviously pushed out a ton of communication. I think we also had to figure out different channels. So with customers, given that so much was happening in the beginning and there were changes in policies as well as in regulation, it came to a point where some of our salespeople had to hold regular conference calls, or we were calling them town halls, with all of the customers. And so they would technically have, you know, a couple hundred people on the call to just get updates and also ask specific questions. Internally, a lot of it was regular phone calls and also emails. I mean, Katie and I still regularly send out weekly COVID updates related to the regions. Just, you know, I think we might have talked about this yesterday, Minnie, the idea that a coin shortage by now would have been an issue, no one would have known. But you start seeing some of these things kind of creep up slowly. So we do kind of watch it weekly. I think to the other question about like what would make it easier for me to interact with other sectors, it just goes again to try and do more for my bang for buck. So to have someone who can kind of talk regionally or across the nation, so that it's one message that's kind of going out. But then also I don't have to be in so many meetings in that sense. Katie's the other person that helps me in CNS, and at the peak, we were probably joining 10 different government calls on top of our normal internal calls to try and like just keep up with every region and push the message, which for the food, it was really important in the beginning to tell the public to not hoard stuff. You're making it worse. You know, you're straining something that's already super strained. And you know, the messaging was, you know, there's enough food, but it's coming in different ways now. And so you need to figure out, if you normally got it in school, where is the government giving it now? If you normally got it at restaurants, they're probably trying to do like Uber Eats now. So that was kind of, you know, the different types of way we're working with our partners and sectors too. But again, it's just trying to push out as much information as you can. And to mimic what Bob said earlier, if you're a government agency, if you're able to put everything online and update it in real time as quickly as you can, I can grab those. That's easy for me. I mean, I don't want to go to 50 different sites, but it's easier for me to do that than it is to, you know, read different emails and try and catch up in that sense.
Okay, great. Thank you so much. Allegra, for the sake of time, I'm going to ask you to save that advice until we get to question number 5, if that's okay. We're going to move on to our next question. Which is for our private sector panelists today. And Carmela, let's start with you. How do you coordinate with states that don't have a BEOC? And how do you coordinate it with other sectors?
Yeah, so that's a good question. So if there's not a BEOC, I try and pinpoint like a local emergency manager, just because I do know they work across different agencies. Technically, every city, state has some unit, if not a full agency, that can do that function. With other sectors, admittedly, I don't think, if there isn't a BEOC, I don't know if I would have one. I might go to a different region that I know has one and then try and make my way the other way. And the third piece would just be my food association, trying to see if they have contacts in that sense.
Right, that makes sense. Mindy, what about you?
Yeah, we rely heavily on our trade association networks. So when we're reaching across states, and we have a number of our members who have operations in our surrounding states or even nationwide. So a lot of the issues that we're all juggling with COVID-19 impact more than just Maryland, for example. So we lean heavily on our national trade groups and then our peer bankers associations. And then I also reach out to member banks. So, you know, to ones that are have operations in California, for example, I'll just reach out directly to them for more information on what's going on in that specific area. So they have been wonderful lifelines through this.
Great, thanks, Mindy. And Bob?
Well, I was going to save this for question number 5 as one of my recommendations, but I'll jump now. I mean, the partners that I have now, I know that they have connections with other states. They have knowledge and information with other 8 states. So reaching out to Molly or to Allegra or to Persia or to one of our other contacts is always, you know, kind of an easy go-to. But for the last, I've been here at AmerisourceBergen going on 17 years now, and for the last 3, I've been doing this emergency response and crisis management full time. Before that, I was part of the corporate security team, and I always had the emergency response and crisis management role as part of my overall job function. But the first year that I came over to our to this role, all I did was reach out and start building relationships. I just picked up the phone and I called. I Googled and called a state and I said, "Hey, who's responsible for this? You know, do you got somebody? Yeah, this is who it is." And I would call them and I just said, "Hey, this is who I am. This is what we do. Somewhere down the road, you might need something from me. I might need something from you. Can I get your name and your phone number? You can certainly have my information and we'll go from there." And many of them have reached out to me in advance to start these kind of discussions. So just reaching out and I have my spreadsheet of every state and some territories as well with who my contact is there. And it took a while to do, and it's one of those tasks that probably not a lot of people like to do, but I did make that a point because I knew at some point in time it would come in handy.
Yeah, that's really smart, Bob. Great. Okay, awesome. And 5 is our last question. Just as a reminder for our listeners who are still on the line, if you have any questions, please go ahead and start thinking about those and typing them into chat or Q&A. And Allegra, I'm going to start with you on this question. Are there any recommendations or resources that you can give others to improve their own resiliency within their own organizations, or any advice that you would give moving forward?
Thank you, Laura. The recommendation that I would give is to empower community members and icons within your industry to continue to facilitate the information sharing and education. Individuals usually flock to people that they know, that they trust, and sometimes government is not always seen in a light of trustworthiness. Flock to this event, not a lot of people took it seriously at the from the beginning, and so we had identified that at the agency, and we were also trying to understand which industry sectors or even which VIPs in the social world or in the sports world could potentially be our spokesperson to ensure that the information that we were divulging and the precautions that we were asking individuals to take were serious. So that is my recommendation. My second recommendation is to continue to encourage and facilitate collaboration with other sectors. So Bob brought up a great point. Now that we are limited in meeting each other face-to-face and summits, which were and conferences, which were great opportunities for networking, are being transformed into a virtual platform, we really we're really missing the point that the whole reason to spend all that money for people to go physically to a location to listen to panelists was really the value of it was networking, because at the end of the day, having that face-to-face interaction and reading that body language or that expression on individuals' faces is not the same even on a video conference, because there's something about that tactful perception of a person. So we really need to work hard to have the members themselves share information within their own industry. And that was a recommendation that was provided to me by constituents such as Mindy and other associations that were pivotal into decision making and into those calls that we were having. They said, Allegra, please keep us communicating and engage with us and have these calls further on, maybe not as frequent. So we had taken a little bit of a break because I wanted people to, you know, take off that stress off their shoulders, find some peace, some serenity. I needed to rekindle my thoughts too. So now that we're coming into the September and into the school year, quote unquote, we'll probably be starting those soon enough as well. And lastly, to spread the understanding of what we do, each and every one of us. We can't keep on going on with assumptions. I don't know everything by any means, and I'm continuously learning, and that's actually the best. I forget who said it, but the best thing about life is that we're all students and we're continuously learning. And so finding ways to describe what one does and to educate is a great way to continue to foster resiliency and long-lasting solutions.
It sure is, Allegra. Thank you so much. Carmela, what would be your one bit of advice for our listeners on the line?
I really had three. So one,
okay.
as I mentioned earlier, was just from a government perspective, understanding supply chains or the network of these sectors, because they are definitely beyond jurisdictions. And now we know it can happen like nationally to the point where we're strained and there is no backup, and there's no backup to the backup. Two is just making more partnerships outside of an event. Again, I use the ones that I already established, and it was easy to kind of speak openly. I mean, I know we've talked about trust, especially in the private sector. You can have your competitor in the same group when you're doing the public-private sector meetings, but just coming there knowing that people aren't going to take that stuff outside or tell the media is helpful. And then the last piece I noticed, it's related to grant funding. So there used to be something called, well, there is the Regional Catastrophic Preparedness Grant Program, but I noticed this year was significantly less money than they've given prior years, and it was different types of cities that I actually saw on there. I call it out because the whole point of that grant was to try and get cross-jurisdictional planning. And if that funding keeps going away, we're never going to get to a point where there is planning related to this, because God bless Zoom and the IT infrastructure that kept working remote going on day one, or I don't even know what would have happened in this country if we couldn't keep that going.
Y2K saved us all.
Hey, Bob, what about you? What would be your one bit of advice for our listeners today?
Well, it's just kind of riding on the coattails, as what I said before. It's, you know, business and blue skies, we might be competitors, but when those skies turn dark, that has to be put aside to the, as much as it can be, you know, as far as legal issues and things like that. And because when skies turn dark, we're all working towards the same goal. And don't be afraid to just reach out and introduce yourself. You never know. And one last thing that I did want to bring up, as I was saying before, I was at the FEMA Regional 3 Private Sector Day, and we were taking a quick break between presentations, and Molly walked up with somebody and said, "Hey, you two need to talk," and kind of turned around and walked away. And a relationship was built. Off of that. In a situation that we could help each other. but all she did was walk up and said, "You two should talk to one another." And I mean, that's how you just never know.
Right.
And then don't be afraid to reach out to others.
Good advice, Bob. Mindy, how about you?
I would have to say, I just find it remarkable how everyone has managed to just turn on a dime and work from home, and all the different challenges that people are juggling every day, be it, you know, the annoying mosquito, or you've got, you know, you're homeschooling and you're doing, you know, full-time work, and all of that, you know, in the office, at home, has just been an amazing thing for me to observe. And I think that's just across every industry. So I think there's incredible resilience already out there. I've been so amazed by that. And I think just what everyone has highlighted is so important, these relationships that we have built over time. And one of the things that really jumped out at me as I was on a COVID-19 working group with the Maryland Chamber of Commerce, and over the course of the conversation, I got a question from an individual who owned a tow truck driving company, and she was having difficulties finding a bank that would work with her on a PPP loan. So the bank that she was currently working with wasn't offering them. And so just by that contact, I was able to connect her with some of my members, and then she was able to start that process rolling. And she was plugged into the chamber, but then she was also plugged into her tow truck industry networks. And then she started to spread the word that way. So it is just impressive how the word gets out. And it is, I think it was well said earlier, it's sort of our human nature of reaching out to each other. And then once we make those connections, it enables us to just be stronger.
Sure does. Thank you, Mindy. Molly, I'll let you have the last word. Yep.
Okay. Robert, I like to say I do my best work when I'm walking away. So I would have to say,
Molly, I can't hear you. Sorry.
I would have to say one thing, not the only thing, but going back to that, all disasters start and end at the local level. Make friends with local emergency management. And for large businesses such as Amerisource or CNS, that is an unholy responsibility for one Carmela or one Bob. But it's not when you have local stores. And something that Walmart does that is a really great model is there's a relationship that National Walmart establishes with FEMA and also state business operations centers. But their store managers are also trained to make contact with the county emergency management agency. And they're trained to say, when you contact them, offer these things, ask these questions. And what that will lead to is a number of other things that perhaps that local establishment of a much larger national business is being better integrated into things like the utilities and where do they fall on the prioritization? Where does perhaps the county put that business in the priority? Are there chemicals in that establishment that emergency management needs to know about, so that if there's even a fire, the local responders know actually how to respond to that safely. So although it sounds like a somewhat obtuse and difficult undertaking to contact the local emergency management, um, I'd encourage folks, if you're a larger business, to use that Walmart model and train your local folks on how to establish a relationship with emergency management. And then on the larger national or state level, you do the same thing with the state emergency management. I think it can open up doors that are difficult to anticipate, but then once it happens, it's kind of an aha and really very exciting.
Great. Thank you so much, Molly. I'd like to thank all of our panelists today, Allegra, Mindy, Carmela, Molly, and Bob, for your time. Apologize to the listeners, we went a little over, but I think that's just a testament to all the good information that we had to share today. So Tom, I just wanted to pass it to you for some closing remarks before we go to a couple of questions we've received.
Great. What a great discussion. I want to thank you all. You know, it keeps coming back to this theme that I think each of you said is that people innovate, not companies or processes or institutions, right? And when COVID strikes, all of you innovated in different ways because you had a connection to someone, or I think, Bob, you said it, you were forced to connect with somebody through somebody because you had an issue. And it's just a great reminder of these trusted frameworks we have to leverage. So we just touched the surface, but I just made a bunch of notes as we were listening. We're going to continue this discussion with some other states and hopefully circle back to this one as we come back. So it's just a never-ending thing. And I want to thank our states for Molly and Allegra. And I'm going to single you two out, but people have no idea how hard these two women had to work nonstop. I don't know, 109 days or something. It was crazy. And I want to applaud you both because you sacrificed a lot, as did your families. Not that everyone else didn't, but I know at the state level, you're in between public and private. It's a huge responsibility. So I want to thank you both for your service in doing that. So again, if you want to register for the SICE, it's up on the screen. This is kind of the front door as far as information sharing on how the private sector works with government. So we want to invite you to do that. And we'll stick around and have a little happy hour virtual. But I want to thank you all for attending and sticking around. Laura, I'll turn it back to you.
Sure. Thank you, Tom. And if you want to start promoting our attendees who are still on the line, Tom, as I read out a question or two that we have to our panelists. One question we have is from Derek. The new FEMA BRIC program includes funds that support partnership development for natural hazard risk reduction. He'd like to know what kind of work would be most valuable to help build economic resilience and capabilities in partnership with the private sector. For example, here in Washington, there is a 20% chance of a catastrophic earthquake in the next 50 years that would render inoperable 70% of our bridges. How would the private sector be interested in working with us on this? Anyone want to take that?
Laura, I just want to say that we are happy. We are actually having our hazard mitigation officer provide the information to apply for projects for the BRIC program in Maryland. But the private sector can't be the applicant. It is the county emergency managers that need to be the sub-applicants. So we are educating. This is our first time around, so all of us are new to this program, but we are educating the private sector as well to be in contact with their local county emergency managers to see what are the needs at the county level so that they could be putting in that request through together as a partnership, because it is a whole community approach. And it is a great point of view and question that what are the natural hazards and risks that are in our state, and every state has an analysis of what are the major impacts of risk. But because this is building resilient critical infrastructures, we are working with our state Maryland Coordination Analysis Center and a risk analyst to decipher what critical infrastructure truly is the one that if it went down, what are the implications of it onto our community based on the FEMA lifelines. So if Derek wants more information, I'm going to provide the private sector integration program link, but also the P sector email. Feel free to email me and I'd be happy to link you with our hazard mitigation officer.
Thank you, Allegra. And I'm going to show my email address on the screen as well in case, Derek, you have additional questions or anybody else has questions. Let's see, something else just came in, so just bear with me. And in the meantime, Tom is going to start promoting our attendees to panelists. So if you want to ask your question over audio.
Yep.
Yeah, okay.
Just invite you all to share your cameras and we could dialogue for a few minutes. You know, we're great examples happening right now. As I'm watching the screen over here, we have a storm coming. It's going to be a bad one, apparently. So you never know until it hits. And right now, fuel trucks are moving from Florida towards the Gulf. And there's an issue, a proper issue, where they're being stopped, you know, because of permits and things like that. So the fuel sector notified their trade association, who called us, and we very quickly, because we have a group of Molly and Allegra working together, our state liaisons, we were able to put them, literally in less than a minute, put them in touch with Beverly, our Florida contact, to work the issue, right? That's because Beverly and myself and Molly, we've been on virtuals for how long? Over a year. And just goes back to this whole point about getting these working issues, planning and working together, solving problems and teeing things up. It's become so valuable. And I'm so happy to see the state's doing more and more of that. So I'll keep you posted, but if we can nip this one in the bud, I know that'll help Carmelo, that'll help the banks, that'll help food for everybody else. Because you run out of fuel, game over. Okay.
Yeah. So Tom, I'm not sure why, I can see you've promoted people to panelists. Their screens aren't coming on. I think that's something they would have to do individually. So we welcome people to do that if they, at this point at the end, they want to come on the screen and say hi to our panelists or ask some questions. We'd love to see you. In the meantime, I just wanted to let our listeners know that the All Hazards Consortium is working on a 2-day virtual conference on business resiliency and really taking the sessions that we've done over the past 3 months, 4 months since the pandemic started, and putting them together in a cohesive training environment, and also a good way to negotiate or to network over a virtual environment. So that's going to be tentatively October 27th and 28th. We are in the early stages of working on that, so we'll let you guys know. Hey, Earl Lewis, how are you?
Just fine. How are you? How you doing, Tom?
Hey, Earl, good to see you.
Tom and I go way back. Again, I'm Earl Lewis with the Maryland Department of Transportation. One question I have for all the panelists is that obviously when this pandemic event first started in the winter, you know, there was hope that when we got to late spring, early summer, that we might go back to normal. Now that it looks like this is going to be an extended event that goes on how long, who knows? How has that changed how you look at your planning and coordination processes, given this is a significantly extended event?
Great question.
Thanks.
Yeah, so I'll go first because I actually am going to have to jump off to attend a hurricane call. But Earl, it's a good question because now I've got to think about simultaneous events. So now we've got hurricanes on top of COVID. And so what does that mean for the food industry? I actually just shot an email to FEMA earlier about knowing that we've been pulling SNAP a lot. There are a lot more SNAP allocations. Usually FEMA also provides assistance post-recovery from storms to individuals that are affected, but now that pot of money is being used for unemployment. It still leaves open questions in the end. I mean, again, we're running into situations where no one would have really answered these questions or brought them forth, but now I'm planning for more simultaneous events happening. And I'm also planning for the idea that absenteeism will get higher. Fortunately, in CNS, we had some absenteeism, but nothing that would have been detrimental, like in our influenza plan when you're supposed to plan for like 30 to 4% of your staff to be gone. I think that still could occur given that, you know, this pandemic keeps going and we might not see a vaccine that's going to help people, you know, prevent people from getting sick. So I think that's what I'm kind of focused on now, is just how to handle 3-4 things happening. And besides the hurricane, there's also huge wildfires happening in California right now too.
Oh, yes.
Yeah.
Thanks.
Thank you. Tom, it's getting late. I think that we should probably, we could do this forever, but let's go ahead and conclude today's webinar. And I just want to say thank you to all of our listeners, but also thank you so much to our panelists today for the information. And we look forward to working with all of you in the future. Be safe, everybody.
Thank you.
Thanks, everybody.
Thank you.